Throughout the Ebola fight, it was evident that community engagement was critical in eradicating the Ebola virus disease. Community engagement is now widely recognized as a critical component of responding to Ebola and other public health-related issues. Civil society organizations and the communities we work in are key players in the delivery of health services, as we have unique advantages in advocacy, demand creation, and linkage of communities to services. On August 4, 2015, our institution, NAMOT, partnered with CODRA and held a one-day multi-stakeholders conference in Bong County, bringing together over 75 participants. The conference aimed at strengthening linkages among civil society communities and county health system, thereby placing the community at the center of the health system. It also provided opportunities for participants to engage and build working relationships amongst health stakeholders, assess critical health issues that matters to them, and foster a basis for concrete actions towards strengthening linkages and collaborations while monitoring for results.
I'm happy to be here this morning for this particular consultative meeting between civil society organizations, the community, and that of the health sector. Everybody have any idea of the Ebola sickness. Everybody became confused. Your own relative, they don't want that to visit you in your home. Neither for you to even stand to talk. And the sector, the health sector became confused. The doctor themselves became confused. Even if you get a pregnant woman to the hospital, some of them don't even want to come around.
Also speaking at the conference, Bong County Health Officer Mr. Samson Azoakwe made a presentation on the topic working to improve community health care delivery system, the roles and responsibilities of the community members.
Recognize that they were part of the solution to that problem. If you do that, you stand a better chance. You know, 3 or 4 years ago, and that was when I encountered Dr. Mugamu for the first time, when Fiji Hospital did not have an X-ray machine, a functional X-ray machine, the communities involved said, we will raise money, we'll take it from our pocket and buy an X-ray machine. And the X-ray machine we got today was because of our community effort. You know, so their involvement has improved the quality of healthcare, our diagnostic capacity at Phoebe Hospital. And we identify people who represent the community and ensures that their healthcare needs are addressed. And those are the people who call the community healthcare, the community health workers, or the GCSEs, nominated by the communities. What do? They establish clear link between the community and the healthcare provider, and the different tiers of healthcare provision. They ensure that whatever we do addresses the patient's needs. Ensure that we provide holistic, integrated, and coordinated care. And they also make sure look at that, it's second to last bullet. And I'm sure this is where we are. To make sure that healthcare is actually what? A community affairs. And like I said, to do that, engagement must be what? Honest and sincere. Not economically driven, not politically driven, not individually driven, or collective, sincere engagement.
One, communities are increasingly being recognized as an integral link in any health system set up to serve them. This has not always been the case. In many communities, there continues to be disconnection between them and the rest of the health system, causing dysfunction in health promotion, prevention, and healthcare service delivery, and thus contributing to worsening health status, especially among the poor, vulnerable, and marginalized population.
A senior healthcare worker or senior colleague, even in the leadership of the Health Workers Association, but they step beyond bound by saying they could not receive and forgetting to know that labor could get anybody, anywhere, at any time. That's true. But he did not sit there, he took that issue out, being an advisor to the association. We don't just speak for ourselves, we also speak for the patients. People who have seen me in the hospital, when I see something that is not right, I say it and tell you that we need to do this. And we have a lot of things that cause some of these things, not all. Like for an example, you go to the hospital, Phoebe Hospital, where I work, in the ER. You have how many professionals person working there? 2. Maximum 2. How possible is it? We say quality care. How possible is it for 2 persons to provide quality, efficient, and just name it, the best for 25, 30 patients? You say ER, which means emergency. When cases come, there should be people available to attend to those cases right away. How possible is that, citizens? We have said it. The biggest issue here is there is no money to employ. When they have graduates walking around the place here.
Essential package, even our national care policy from 2011 to 2025 says it will be based on an intersectional collaboration. They say that the healthcare system should not work alone. You get all the other sectors, because food security is talking about in the federal district where you have clinics, you got people that you send in, the people, nutrition services will be there. You're going to tell me I need help and where I should build it. Community care services and delivery to people where they live and work. That's how my healthcare says. I'm not going to work to clinic before I get health service. You must work to me. Take for instance, Dean Town. There were people back on the working there. No health facility. They got to work to Bata, work to Zoweta, work to Glota, is where they get health care. And there were the people living, there were they working. So you must carry their health services to them. Their community participation in healthcare delivery at every level, planning, decision, and implementations. Don't bring things to me. What do you want to do? When you were planning, you were there.
Volunteer, right? Now, their role to carry on her talk in the community. To make sure the community is clean. To give messages from her facility to the community. Do active and passive community surveillance. Let me talk about this. Active and passive community surveillance. We have a lot of priority diseases in our community. the passive surveillance and surveillance to keep watch, to check on. So the passive surveillance is when I'm here, then you call me. You say, Mr. Yao, there's a patient in the community, please come. I mean, I will inform. But the active is we are going out to check. When Ebola came, they used to call us more Ebola cases. But what happened was we noticed that we shouldn't just sit down and call us. We had those GCPs to go into the community to check for sick people.
For Bong County, we are all members of this community. And our target is to have an improved health system, right? You work to make sure that a particular disease condition does not occur. Then you are trying to what? To prevent it. In case it happens, you have to be a part. So you won't sit and say, let go do their thing. For me, I don't care. We had an experience with the Ebola thing, and that's why Ebola overtook us. Because when it started, some of us who knew what Ebola was, because we have studied about it, we talk to people, say, Ministry of Health really need their money again. So, my man, I think you're talking, go on outside. Why you say I'm not shaking? You know how many times I've been shaking? I'm a tradition, I'm a teacher. It was not easy. We had to talk, to keep talking. So we got involved. And one of the ways, like for me personally, as a community member, what I did was I produced a song. And I know if you listen to that song on the radio over and over. And I did it in Pele because I wanted majority of the people to get the message. So we have to be involved as community members. If we have problems in the community, we are the ones that have to make sure that those problems get solved. When it comes to achieving good health, when it comes to making our community to be healthy enough, we all, not one person, we all must be part of that process. It will cause you to give support, to give rights, or to give money, or to go and clean the community. We have to be a part.
In our own governance system, one side is the government, we call it the duty bearer. Another side would be the private sector, that is the company, and the civil society from which we come from. And all of us play an important role in the health system. The civil society, I'm called to discuss the role the civil society plays in the health system, if you like, to health workers. For too long, we from the civil society background have been used to be observers. And because of that, we are always there to talk. Government have called civil society as observer. When we go in different meetings, we call to observe. Because they say we are the watchdogs. But I think it's not time it will come to the health sector that we will not only be watchdogs, but we should be actors.
The way we work with the health system is that we should be involved, all the community. As a commissioner of the district, we have not been involved in the health system. So it had caused a whole lot of problems. But I didn't know that we were important to the health system because they had never cooperated with us. So at the end of the day, they started holding meetings. I also tell them thank you for just thinking that little fast way of grabbing onto the commissioners and the chiefs. Had it not been so, we all are going to be lost. We need to be included in the health system because our people listening to us, and everything you are doing is in the district. Everybody came from the district. Now we have some people in the district called GCAV and other group. We don't even know them. We see some people passing with a bucket of drugs and they call themselves GCAV, and we don't know how they were included, how they created them. But still we see them passing, and we feel that we can't question them because the health system is different, then the community people are different. So we couldn't embarrass them, but we just got to know that it was important for us to ask them.
The only way that we can make sure that we can combat any disease that comes, we should work together. We should understand one another. We should be honest. Okay? The health service provider must be conscious to know that the people of the community are the custodians of basic health information that will guide them. We are the entrance of the district. You cannot do it successful in anything to do with the people if we are not involved. However, stakeholders in the community or district must have regular meetings with citizens to discuss health-related issues. Recommendation. The government of Liberia, through the Ministry of Health and other partners, must, one, involve community stakeholders' participation through training and coordination meetings. Two, strengthen the capacity of the Bong County health team to effectively deliver basic health services.
What is the linkage between the health system and the local governments in terms of getting the full participation of community people?
Well, I want to know what where you people put in place that you people are doing to monitor the functions of the GCAV in rural communities.
Yeah, you see that we should be fair. Any cases in the community, we see anything to go on as a community health report. But most of the time, when we refer some community, they refuse the patient and send them out of us.
What can we do to prevent the spread of communicable disease or diseases? One thing I could look at is reporting people who have communicable diseases.
My concern had to do with the traditional Mewa issue. Because I can remember during the Ebola crisis, those people help us a lot. People that live far also know like what the people were saying when you pregnant, you don't know the hour you are getting pain. And some people when they get in pain, it takes only 1 or 2 hours to deliver. In case if somebody were way in Siamba the night want to come on the road and that person deliver on the highway, would that be right for those that are in the hospital to not accept that people to inject to get them vaccines?
The question is general. Considering all of what has been said in this building, what could be an alternative? Can there be any possibility where these things will be written out? Just maybe a little group here. But a lot of people can read a lot of things. Even PhDs and masters and high school students who are not here can read just what you talk about. And maybe that will ring bells in their ears. Is there any alternative?
Motorcyclist has been working in Liberia since 2002. During the heat of the Ebola crisis, Motorcyclist received funding from USAID's Office of Foreign Disaster Assistance to implement the Ebola Community Action Platform Project, which goes by the acronym ECAP. The goal of this project was to reduce the spread of the Ebola virus nationally through a community-led social mobilization campaign. 77 organizations consisting of both international and local organizations were sub-granted and formed a network to carry out social mobilization activities across the 15 counties in Liberia. Among these organizations were NAMOT and CODRA. As the EBD crisis raged on, it was of key importance that there was a need to tackle this disease at the very grassroots level.
Based on issues raised from the conference, NAMOD has realized the need to develop a framework for strengthening community health systems through coordinated approach in community health response in Liberia.